focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
Breaking the glass ceiling never scared Mindy Mcilroy, but a Parkinson's disease diagnosis at the age of 44 did.
Shock. It was, I only knew Parkinson's as an old person's disease.
Dr. Ihtsham a neurologist and chief of the Movement Disorders Division at UHealth, says that's one common misconception when it comes to Parkinson's.
Typically, it's a condition that pops up in someone's mid-60s, but absolutely there are patients who get it in their 40s. People think of tremor when they think of Parkinson's disease, and that is common, but that's present maybe in about half to two-thirds of people who have it, depending on age. What you have to have is stiffness and slowness of movement. I'm not as fast as I used to be. It's hard to take things out of my wallet or get stuff out of my pocket. Buttons are a little bit harder than they used to be.
Because patients present differently with Parkinson's disease, Dr. Hawk says it's important to identify what causes their symptoms. That way, patients can take advantage of targeted therapies for better outcomes and quality of life.
There are different kinds of Parkinson's disease, different genetic causes for Parkinson's disease that have slightly different mechanisms. I think the really exciting work is in identifying those earlier mechanisms of disease that potentially have intervention. We already know that two interventions, exercise and exercise, because I can't emphasize it enough, make a tremendous difference in how Parkinson's disease progresses over time.
I swim a lot, I do yoga. Just the simple walking makes a big difference. Just have to move your limbs.
UHealth's Movement Disorders Division offers patients coordinated care.
So we have an interdisciplinary clinic where patients come and over the course of half a day stay in that room, so they don't have to worry about moving around. And each of those providers comes in to talk to them. And then at the end of that session, those providers talk to each other and come up with a plan specifically for that patient that integrates all the things that those providers talked about.
I really believe that surrounding yourself with a community of people that understand, having support is really important.
Mindy travels and still runs a very successful company. She wants people to know a Parkinson's diagnosis is not the end of the world.
That if you're in the right hands, if you're getting the right care, your symptoms can be managed and you can really live a whole robust life.